So with shoulder rehabilitation, especially rotator cuff rehabilitation, we use a lot of TheraBand exercises. This is a typical type of TheraBand. They come in all different types of colours. Just grab these ones down here. Yellow is the easiest, and you can get these from your physio. You can get them from sports stores as well. They're pretty cheap. You can go through different phases as well as you get a bit stronger. The blue ones have more resistance, the red ones have more resistance, and the black ones and the green ones. So you probably want to check with someone to make sure that you get the right type of and colour of TheraBand. Usually, for most people with shoulder pain, you definitely want to start at a yellow one, because with all of these exercises, we don't want to do anything which is going to aggravate your shoulder pain. Okay. With these exercises, you get your TheraBand like this, and we're going to do 3 lots of 15 of each of these different exercises. So the first one is what we call external rotation, and it's a movement which is going to strengthen up the rotator cuff muscles specifically. So start off in a good position, get a small towel and just place it underneath your elbow and in by your side like that. What that does is it opens up the shoulder joint to reduce any type of impingement or pinching inside the shoulder, which is really important to make sure that you're not flaring the shoulder up when you do the exercises. Keep your elbow bent 90 degrees, shoulders back and relaxed, and the first exercise is very simple. Just pull your arm away from your body. That's perfect. Go through a set of 15 just with me. I'll get you to count it out in your head count. With this exercise, it's important you don't push back too far and you don't push it too hard. All you want to be aiming for is about 50% of your maximum strength going into each contraction. So it's only about halfway. You don't want to do it too hard. And the reason for that is that we're working just on the stabilising muscles, which are the rotator cuff muscles, which at the moment are really just working to keep that shoulder joint in place. If you're trying too hard and you're really forcing it, or maybe you've got a TheraBand which is too hard for you, like a black one for example, what you'll find is that you're using a lot more of the larger muscles, which is your deltoid, which don't have any stabilising action on your shoulder. So it's very counterproductive. So it should just be nice and easy. Again, no pain. Make sure everything's at the right height. Is that 15? Okay, perfect. Once you've done your 15, all you do then is turn around. Exactly the same position. This stays in here. Your arm stays out to the side, and with this exercise you're just starting probably about 45 degrees out from your body and turning the band in towards your stomach. Again, your shoulder blades should be nice and relaxed. You want to probably be bringing your shoulder blades in just a little bit to make sure that they're in a nice stable position. Having the towel under the arm again is going to keep the shoulder joint nice and open. And you're just going to run through again a set of 15. So these are the most basic exercises. Once you start to get a little bit stronger and the pain starts to reduce in the shoulder, you can take that exercise up to different levels, and you can do this exercise in different positions. We won't really get into that today, but certainly it's something that it's not the be-all and end-all of shoulder exercises, but this is the place where you want to start if you're trying to rehabilitate your shoulder stabilising muscles or the rotator cuff. Okay. So notice how Cameron's not coming too far out to the side when he's doing this exercise. His body's nice and straight, his shoulders are pretty relaxed, and the technique's nice and slow. If you're having any pain with this exercise, again, it might not be the right type of exercise for you, so just make sure you check with the doctor or physiotherapist to make sure that you do have a rotator cuff injury and these are the right type of exercises for you. After that, just one more simple exercise. It's just called extension. You start with the TheraBand out in front of you, and all you're doing with this one, with a good posture with your shoulders back, pinching in the shoulder blades again, a set of 15, nice and easy towards yourself. You don't need the towel under your arm for this one. It's important that you keep in your thumb pointing forwards, because what that does, if you've got your thumb turning over, that will rotate your shoulder and actually pinch within the shoulder joint. So you always want to have your thumb turned out, even for those other exercises, the rotational exercises that you're doing. So a nice slow set of 15, and this is about the pace that you want to be doing at. Shouldn't be causing any pain, should be fairly comfortable. You don't have to go right the way back. It's basically a movement through the middle of the range, and again you're only probably pulling it at about 50%, if that, of your maximum. Okay. Normally what I find is once people start doing these exercises, they'll start to notice some differences in their shoulder only after about 3 or 4 weeks. So it does take a little bit of time for these muscles to actually start to strengthen up again, just like with any exercise program. So don't be too concerned if you started off nice and slow and you're finding that after the first couple of weeks you're not seeing a huge difference. Usually after about 3 or 4 weeks you'll start to notice that the muscles are getting stronger. Once you've done your set of 15 of that, I like to go back to the beginning and run through everything 2 more times. So you're doing 3 lots of everything all up.